More disturbing news tonight for Obamacare, and more expensive news for the taxpayers funding it. It turns out the few health insurance co-ops that have managed to survive so far are on the critical list and not expected to pull through. Chief Congressional Correspondent Mike Emanuel has a look at the numbers tonight.
An analysis of financial documents reveals 8 of the 11 remaining Obamacare health insurance co-ops appear likely to fail this year. The co-op program was originally funded with $2.4 billion in taxpayer dollars in 2010 that were supposed to be repaid. The Daily Caller was the first to report on the expected collapse, and the White House offered this response.
What we would like to see in general is increased competition. That's exactly what we've got. We also were looking to save money. And there, over the next 10 years, we will find, and this is something that even the CBO has concluded, tens of billions of dollars in deficit reduction as a result of the Affordable Care Act.
12 of the original 23 federally funded co-ops have already failed. The co-ops are insurance companies designed to increase competition and lower costs.
They were a artificial and you could say hopeful creation propped up by political forces in Congress which wanted to try to use public money to experiment with a different type of health insurance coverage. It never made a whole lot of sense from the start.
The Centers for Medicare and Medicaid Services isn't identifying the 8 at-risk co-ops, but those with the biggest losses in 2015 were Massachusetts, Oregon, Ohio, Connecticut, Montana, Wisconsin, Illinois, and New Mexico. Last month, the acting administrator of CMS offered a Senate panel a very sober assessment.
And these are small enterprises, and I think it's very fair to say that the risk of failure of these co-ops is quite high.
In another blow to the Affordable Care Act, the nation's top insurer, UnitedHealthcare, is quitting 2 Obamacare markets. The insurer will not sell plans in Arkansas and Georgia next year. The problem is Obamacare relies on private health insurance companies to sell policies that people can buy in government-run markets. With a majority of consumers complaining in recent polls about fewer options in 2016, UnitedHealthcare scaling back certainly won't help. Brett?
Mike, thank you.